Rural and regional Australia know the pain of drought, but now they're dealing with a different shortage. It's the doctor drought, and towns without GPs are suffering. Even the critically ill have to wait weeks and travel hundreds of kilometres to see a doctor. This special current affair investigation finds that country people are dying more than a decade earlier than their city counterparts, and the cost to once thriving communities is enormous.
This is a part of the country that people are flocking to for good reason. Mudgee in the New South Wales Central West, 3.5 hours from Sydney, is prime food and wine country, a major drawcard for tourists, tree changers, industry and retirees. The area, with a population of 26,000, is booming, but basic services like healthcare just can't cope.
This is a full-blown crisis that is having a devastating effect on people's health, and it is only going to get worse.
No, I haven't ever seen it this bad, and I think a lot of other small country towns are suffering the same situation.
It's like living in a third world country.
The initial tests have all come back reassuring, which is fantastic.
Edward Lee's been a local doctor for over a decade. He says it's the best job in the world, but he's at breaking point.
It is a heavy burden on the doctors and healthcare people at this practice to know that there are people who are suffering.
And it takes a personal toll?
It certainly does take a personal toll, and then all the people that are needing your help, and it keeps coming and keeps coming.
With just 9 doctors for over 1,000 appointments a week, existing patients struggle to get in.
Look, I'm sorry, we've got no appointments now until January.
The sick forced to line up outside, hoping they can be squeezed in.
It is at a crisis level. It's a disaster for the patients of Mudgee and the surrounding regions.
So the clinic's taken the drastic step of closing its books to all new patients, a decision Mudgee's only other medical centre had already taken. Practice manager Colleen Best.
It was really tough. It was a decision that we didn't take lightly, but we had to do it. They've got no option but to travel to another town to see a doctor at the moment, which is, it's just frightening.
Local independent federal MP Andrew Gee says lives are being lost.
I spoke to one local doctor who had met with a patient who had advanced cancer and who had not been in to see a doctor because that person could not get an appointment. It's costing lives, and country people are paying a very high price for this.
Trish needs a double lung transplant to survive.
Because I'm suffocating to death.
And I can see you're struggling to breathe now.
This is normal.
She has end-of-life emphysema and asthma and has to drive 2 hours to Dubbo to see her specialist. When Trish suffered a severe asthma attack last year, local nurses were forced to dial in via telehealth to save her life.
We just have a virtual doctor come on the screen. We've had that for years.
So no face-to-face doctor to help you through an asthma attack, to help you through major health issues?
Yeah, nothing.
How does that make you feel?
Well, my end might be coming a bit quicker. That's how it makes me feel.
Without access to a doctor, she's reduced to diagnosing and treating herself with her partner's medication.
I grabbed a box of his antibiotics, and as soon as I knew I had it, I treated myself. I know I shouldn't have. My doctors will probably not be happy with me, but quite frankly, I don't care. It got rid of the chest infection.
But Trish, that's not good enough.
It's not, but if I didn't get rid of that chest infection, it wouldn't have ended well. I might not be here.
Lucky, come here, bot.
Lydia and Carlos are among the region's many tree changers. And with a new state-of-the-art hospital, they assumed they'd get the healthcare they'd need for Carlos's diabetes and the breast cancer Lydia's survived.
And we thought, wow, this is a bonus to have something like that in a small town. So that's why we picked to come to Mudgee. But now we know what it's all. The doctors are now closed all their books, and we've had to go back and see our doctor in Sydney. So it's a 3-hour drive if you have to go back and see her.
They're now planning on leaving altogether if the broken system isn't fixed.
If you get sick, you go to the hospital in Mudgee and you wait for up to 10 hours because everybody's using the hospital for everything because they can't get into a doctor.
10 hours.
And we ended up seeing a paramedic.
So after 10 hours waiting,
yep,
you still couldn't see a doctor?
It would have been quicker for me to go to Sydney, see the doctor and drive back, and I would have saved maybe 3 hours off my time.
Incredibly, Mudgee's in a better position than towns nearby that are putting even more pressure on the services there are. The town of Gulgong is about 20 minutes north of Mudgee, and for its more than 3,000 residents, there's been no doctor at all for the past 9 months. To make matters worse, it looks like he's not coming back. Locals have told me he's unwell and has moved overseas, and that his medical practice is now up for sale. With the clinic literally gathering dust, the local chemist is now the front line for healthcare. Pharmacist Steve Whitaker has enlisted a nurse practitioner several days a week to help, but admits it's not enough.
So they're missing out on their regular checkups for their high blood pressure or their diabetes, and obviously missing out on diagnosis as well of new conditions. We can fill some of the gap, but we definitely still need that GP as part of the team in these country towns.
An hour south at Wellington, Dr Ian Spencer works 12 and 14-hour days. At 76, he'd like to retire, but feels he has no choice but to stay.
This community is my second family, and having worked here for so many years, look, I just would not want to walk out and close down and leave them stranded without medical care.
Back at Mudgee, the medical centre has put together a promotional video to try to entice new doctors to town.
Mudgee's improved the quality of my life because I'm a part of a community. I can be a mother, I can be a doctor, I can be a friend, I can be a teammate.
The area's key industry, mining, is having to bring in its own doctors to care for workers and their families. And with a population set to boom another 40% over the next 2 years, this is a crisis that's only going to get worse.
Here in outback Queensland, we're 2,000 kilometres away from the decision makers and politicians in Canberra. Mount Isa is a northern mining hub. There's workers, young families. It's a favourite for grey nomads travelling Australia. But right now, the people here are facing the worst health crisis many have ever seen.
The population of Mount Isa is 20,000, and 17,000 of them come to my medical centre.
A medical centre with only 2 permanent doctors.
It is the worst I've ever seen it.
We wait weeks to get into the doctors here in Mount Isa.
In a town facing a slow death.
We need more doctors.
But nobody stays. No doctors stay, unfortunately. I don't know why.
A very good morning to you.
Hello, Dr. Michael.
Welcome to the Mount Isa Medical Centre.
Thanks for having us.
Thanks for coming.
No worries.
Yes, another day, another dollar. Let's go.
All right. The calm before the storm?
Absolutely. Wait till you see what happens later on.
Dr. Michael Mbagu moved to Mount Isa over a decade ago. It's a stark contrast to his UK homeland. But thank God he did, because he runs the main medical centre in town, and he and his wife, Dr. Moji Fakiese, are the only fully trained general practitioners willing to work here full-time.
We have 15 consultant rooms, so we've got the rooms. We just need doctors to come in and occupy them.
Extremely desperate. You know, this town can do with at least 10 more GPs. Easy.
When the doors open at 8:30 in the morning, the patients just keep coming.
Mr. Terence Janke, please come through.
And the phones don't stop ringing.
Good morning, this is Mount Isa Medical Centre.
Receptionists Elizabeth and Shari are forced to turn people away, desperate for an appointment.
Yeah, no, so we don't have any appointments until the second week of January. The only option we can do now is put you on the cancellation list.
Have you ever seen it this bad?
No, it's really quite bad at the moment.
Angie urgently needed antibiotics to treat an infection. She only got an appointment by chance.
Thanks for fitting me in. I'm so glad that there was a cancellation, otherwise I'd have to wait another month or so.
Or if you've got a broken arm or something, but you can't get in, just wear the broken arm for a month.
We can't do any more. We are open 7 days a week, and oftentimes I work between 60 to 70 hours a week.
Without you and your clinic here, Mount Isa would be stuffed.
Yeah, I don't even want to think about it.
What is it? Why can't we get any doctors here?
For a start, we have to be honest about the whole conversation. This is Mount Isa, it's not Mount Paradise.
If you recruit them, it's hard to retain them, so they spend a year or two and they pack their bags and leave.
I guess we're a long way from anywhere.
Dr Mo Stain-Allam is one of 2 trainee GPs that also work at the clinic. He says he's learning more here in Mount Isa than he would in a city placement.
You get to do good medicine here. We still have to practice to the same standard as anywhere else, but with limited resources and limited doctors. So your skills are actually extended. You get a more extended scope of practice here. So we don't have dermatologists, we don't have ENT doctors.
He's a Canadian national and one of the few that has stayed.
I think there's a perception in the big cities or when medical students graduate that living in rural towns is not tenable for them.
So we've had to recruit a nurse from New Zealand, sponsor them to come here, because we couldn't get anyone locally. We couldn't get an Australian nurse, to come and work here, with us.
Isn't it sad that our own people don't want to come here to fill those gaps?
Doctors are no longer interested in general practice. They're more interested in the specialties because it appears that they get treated better, and we don't get a lot of compensation, a lot of remuneration for what we do.
Especially in Australia, in the Western world, this is not a third world country, so something should be done for the town.
We need help, we need doctors. It's a lovely place to be, it really is. I haven't met anyone here in 3 years that I haven't liked. Everyone is friendly, sociable.
By the time I get home, my kids are already in bed, so I get to see them in the morning, and that's it.
Not many people would do what you're doing. I'm worried about your well-being. You're basically the backbone of this town.
You're sounding like my mother, and that's what my mother tells me. That's the end of another day at the office.
Another busy day?
Absolutely.
How many patients did you get through today?
50.
50?
Absolutely, 50 patients. It's not sustainable on a long-term basis to be doing this. Absolutely not.
You can't help but feel the burden rural GPs carry and the responsibility to manage the health of thousands, many their neighbours, friends and farmers. So what happens when more country practices are closing rather than opening? What happens when your clinic is going broke? Here in country Victoria, the Royal Flying Doctor Service is putting its funding to the test.
If we weren't flying into some remote places within Australia, they would have no primary health care at all.
People in country towns are putting their health last.
The life expectancy for someone born in remote Australia is 14 years less than someone born in the city.
145 jobs, that's just the ones that are advertising.
Michael Veal has always practiced in small country towns.
A couple of years ago, you had 29 medical centres in rural Victoria go into bankruptcy. So those practices are not advertising because they're no longer there.
For 25 years, he's been a GP. He's never had so many job offers.
People are saying there's a crisis coming. I think that crisis has been and gone. I've got people driving more than 100 kilometres each way just to come and see me as a GP. That's ludicrous. There needs to be a state and federal plan for what we're going to do, because we can't just write off country towns.
Michael is based at Creswick, about 2 hours from Melbourne. He's booked out every day and still sees new patients right across the region.
The doctors in the adjoining country towns of Maryborough, Denali, they're not accepting new patients.
If you're sick in Maryborough, good luck.
Maryborough's population is more than 8,000.
If you want an appointment now, you wouldn't get one till March.
81-year-old local Terry says,
You've got to anticipate your illness.
Sick with pneumonia, Wendy drove herself to Bendigo, 70 kilometres away, just to get help.
They'll say, well, we haven't got anything until such, and well, you could be dead by then.
Clinics around Victoria's Goldfields region have been at capacity for a decade. Doctors have to close altogether just to go on holidays. And pharmacists are forced to be lenient with owing scripts.
My blood pressure was through the roof, and I was told the earliest I could see one was 2 weeks' time.
I think that people are feeling abandoned in country Victoria. We've got roads full of potholes, we've got empty shop fronts, and we've got failing medical services.
Nearby at Avoca, residents went without a local doctor for 18 months.
People turned up to see their doctor on the Monday morning and there was simply just an A4 paper in the window saying this practice is no longer open.
The practice went broke, but Michael took it over. He's now the one and only doctor in Avoca, 1 day a week. Did you take it over out of guilt?
I was watching football out at Avoca one day and a kid had his face all smashed up. And I just thought to myself, this is ridiculous. We need country doctors in country towns.
In the absence of a doctor, Avoca's vaccination rates plummeted. Diabetes and advanced cancers went undetected. Locals are sceptical about how long Michael will hang around, but are grateful he's there. Many hadn't seen a doctor since the clinic closed. Others just got by with telehealth.
You need people on the ground. You can't telehealth a broken arm.
The need for general practitioners is only set to soar. In 20 years' time, it's projected Australia will be short more than 11,000 GPs.
Your average GP is into the mid to late 50s.
This year, the college has increased the training numbers by 20%, which is a great increase. And in rural areas, it's about 17%.
President of the Royal Australian College of General Practitioners, Michael Wright.
So help is coming, but it's not going to be a solution overnight.
But while we wait, how long can GPs like Michael straddle 2 clinics? How long can they fight off burnout and keep accepting new patients? How long can they afford to keep the doors open?
On average, small country towns have a lower socioeconomics. There's more dependence on Medicare. Medicare's been frozen for the last decade and a half. It's fallen well behind the cost of actually running a business.
That's where the Royal Flying Doctor Service wants to make a real dent.
We're there not to make a profit, we're there to make an impact.
Michael Ben-Meir is the CEO at RFDS Victoria.
We are buying GP clinics so these communities can have good primary health care.
In the past few years, the Flying Doctors have bought 6 remote clinics around Australia and fly GPs in. It means doctors aren't left juggling the costs of running a practice and raising their family in remote Australia. And you're happy to run them at a loss or just break even?
If you can get support to break even, then you can do many, and really, hopefully, be a big contributor to the solution.
In Victoria, they have just 1 clinic in Robinvale on the New South Wales border.
There's a full radiology suite in the local hospital that hasn't had anyone staffing it for the last 6 years.
Dr Anita Moss is a part of their rural women's service and flies into Robinvale so the area has a female doctor.
People are booking in regular appointments for the next 12 months just in case they are ill or one of their family members is ill.
But for the flying doctors to buy up more clinics in these desperate Victorian towns requires a change at a federal level. Currently, the RFDS can only access Commonwealth funding to purchase a practice if it's located in an area deemed remote.
Victoria doesn't have anything that's defined as remote by a scale called the Monash Modified Scale.
The flying doctors bought Robinvale without federal funding, but need help to buy and run more.
We need some support, we really do.
Well, you're kind of like superheroes flying into these regional towns.
Yeah, we've long been known as the service that flies in and picks you up when you fall off the cliff. But increasingly we want to be the service that puts the fence at the top of the cliff so you don't fall over in the first place.